You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey everyone, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly, and today I've got Kenneth Joubert, Dr. Kenneth Joubert from South Africa. He is a specialist veterinary anesthesiologist and he works in private practice here in South Africa. He's no stranger to Online Pet Health. We have had him to lecture to us. We've had him on the podcast before. So welcome, Kenneth.
Hi, Megan. No, it's great to join you today. It should be fun to have a discussion.
Yeah, I think this is a topic that people are going to find really interesting. And it's one, as a vet, myself, I've been exposed to. And, what I found when I was in veterinary rehabilitation is that owners will get referred from another vet, and the vet will prescribe some non-steroidals or some painkillers. And then by themselves, they've decided to give other supplements. And often these include herbs. And one of the worries is that, the vet that's referring often doesn't know that the client is giving these herbal supplements. And there's this tendency with pet owners that anything herbal or natural doesn't have any side effects, and I think that is in sort of the human population too. We think that something that is natural is safe. And, one of the things that I found was that these pet owners would say to me, my vet doesn't know that I give these things, because I don't think that they'd agree with them or they don't know anything about them. And, from when I was at vet school, I don't remember being taught anything about herbs. And it was only sort of post-grad, after doing the CCRP and doing acupuncture and learning about herbal treatments that I was wanting to use in my patients, that I got this knowledge. And so I put myself obviously in the primary vet's shoes when they refer to us. And, I would like to know if my patients were getting any other supplements. And I just think that it's a responsibility of the vet rehab therapists to point this out to these owners, especially if they don't have the knowledge about possible interactions between drugs and side effects. And we need to then refer them back to the primary vet to say, there's a potential that there could be some side effects or some problems with you mixing these supplements together with the drugs that you're giving. Is this something that you found in practice when you've been treating some of your chronic pain patients?
Yes, I think this is always going to be a problem. People search through the internet the whole time to find magic solutions for chronic diseases, and often herbal remedies, natural remedies are recommended along with a whole host of supplements, and sometimes as magic cures, if I can put it to you that way. And we live in hope. I always think it's important to remember that our original drugs, in actual fact, come from herbal remedies. So aspirin, for example, which comes from willow bark from 1823 or something like that, is a natural remedy, but it's been developed as a drug or a medication. And there's, for example, digoxin, which comes from foxgloves. We can go through a whole lot of conventional medicines which actually come from herbal remedies. And so herbal remedies, some of them are actually medicines. The problem with it is it's not a regulated industry. And supplements and these type of natural medicines aren't very well regulated. If we wanted to register a new medication today, we'd have to go through either the FDA or the EMEA in Europe or our own Medicine Control Council, supply data which shows that it's safe and effective, that it works, side effect data, and a whole lot of other things to show it. But for a natural drug, you don't have to. That's the scary bit about it. You can almost mix things together and it can become available on the market very, very quickly. So
yeah, and these are often just mixed with joint supplements, aren't they? I mean, they're herbs that you see within joint supplements. So the owner might just be thinking they're giving a joint supplement, but there's a whole lot more in there.
Yes, absolutely. So people tend to, and if you look at a lot of things, we're talking about osteoarthritis, you look at some of these supplements, they add something of everything that we know that works. And it's not uncommon to find supplements that have everything from glucosamine, chondroitin sulfate, MSM. You can go down the list, including things like devil's claw, turmeric sometimes get added, etc. And people put a lot into these supplements because they say, oh, all these things have been found to work, so I'll put them together. And we assume that they're safe, but certainly they can interact with conventional medicines. And there's no doubts about it. If you go through the FDA, they've issued some serious warnings where herbal remedies or herbal medications in actual fact have been used with conventional medicines and have resulted in death. I think the big problem with that is it's not an area that's researched. The conventional pharmaceutical models market is required to show safety and efficacy, and when drugs are commonly used together, they have to produce safety data that it's safe to use these medications together. For herbal remedies, there's no requirement to do so, unfortunately.
Do you know of any current research now looking at animals and medications with interactions in herbs?
I'll answer this a different way. There's not people who are going to fund it. So it happens in a haphazard fashion. There are a couple of groups that work together that have phytomedicine groups that are exploiting and developing phytomedicines, but they're looking for new drugs to solve new problems. And only once they go further down the chain will they start looking at drug interaction. So a large portion of our knowledge more comes from the medicine control authorities where adverse drug reactions are reported. So they get information that people took a conventional drug and they developed a side effect or they died or severe disability from it. And they look at all the information and put it together and they say, hold on, but they were taking these supplements and they were taking these herbal remedies. And eventually over time, you find correlations between it. The other way that we work it out is by understanding, and there is research into some of our herbal remedies which tell us how they work. So, for example, arnica has an influence on cyclooxygenase enzymes, and our non-steroidal anti-inflammatories work on cyclooxygenase enzymes. So it's very easy there to see, okay, there's a very good possibility of a drug interaction happening there. And we can start to work or predict that these type of drug interactions would happen. But the funding is not there to go and research it because we would require the people in some ways who make, or the companies that make herbal supplements, to put in the research to find out about safety issues. And it can be a bit of a hit and miss approach because there's so many potential combinations that are available that it often only gets found out later when you mix things together and think, okay, there's a problem, gets reported as an adverse drug reaction, and then the data starts to develop from there.
And what are the type of kind of side effects that you see from these interactions?
They can be very simple side effects to side effects we never ever see. And I'm an anesthetist, so there's a theoretical aspect. If you give 5 medications, your chances of statistically seeing a drug interaction is about 80%. And most of those, none of us even notice. It goes by in a blink of an eyelid and you never see an effect. It may delay metabolism of drugs slightly, for example, or enhance the effect of a drug slightly. So just to use some examples, cannabis has become really popular as a therapeutic agent, and we know that it enhances the uptake of opioids into your central nervous system. So in other words, you'll get a more rapid or a more marked effect if you use the two in combination, if we look at the research data that is there. That can be beneficial, by the way, and it can be harmful. It just depends on which side you're sitting at and the effect you actually want to get to. So it's important to look at what actually happens and try and work out, is this of benefit to the patient that is there? I don't always know exactly what the right answer is, because we need to explore these avenues to find new medications and drug interactions, for example, but at the same time to be cautious and observant. So if we look at a supplement like St. John's wort, for example, that has reported numerous drug interactions. So it's always one thing when I ask people, and people, by the way, don't always tell you the truth. This is the sad part to it, about herbal remedies or supplements, for example, to find out actually what they're giving. And there are some people who use Chinese supplements. And yeah, sometimes it even comes with the genuine Chinese labels, which I cannot read. I don't even know what's inside them. And that makes it really entertaining. But they've bought these things and you think, well, what is in here? In terms of that, homeopathy, for example, doesn't worry me. If people are using homeopathy, that, there's very few drug interactions that have ever been reported out of that with homeopathy. And they're usually quite safe to do it if they're true homeopathic medications. But what I also find is that what some people think is homeopathy actually isn't homeopathy. It's herbal medicine. And some practitioners who do homeopathy actually do herbal medicine and homeopathy, and usually they're involved in other alternative medicines like acupuncture, for example, and so on. And the owners don't quite know, but they'd like to believe it's homeopathy with nothing. And then you go and actually read it and you discover it's actually a herbal medication.
Yeah, I think that's right. I think that there is a lack of education for the pet owners. And so they just group anything that's herbal, homeopathic, natural in one group. And sometimes they call it homeopathic. I've experienced that myself. These herbs, obviously, there are times when they can have a negative effect and an interaction. Are there any situations where you've used herbs or herbs have actually have a positive effect on a patient, so maybe decreasing side effects?
Those things, yes, they happen. As I say, to me, an interaction is an interaction, and the one I mentioned earlier with cannabis can be both positive and negative, for example. So there are interactions which could be beneficial. And for example, people who want to use arnica, I'm quite happy for them to use arnica. I just want to know that they're giving the arnica. And then I will try and avoid non-steroidals because we know that they have a similar mechanism of action. And therefore, you'll get a harmful interaction, or you can get increased risk for gastric ulcers or bleeding tendencies, for example, if you use arnica with some of the conventional non-steroidals. So I just want people to be honest about it, that we can utilize. Sometimes using that drug actually is beneficial to the patient. There are times, for example, with nausea, for example, there's some natural remedies against nausea that are available that work very well for some of the dogs, especially cancer dogs, for example. And that's another group of patients where those owners give lots of things to their dogs because cancer often carries a poor prognosis and they're desperate for help. So they go and search for the internet to find the next magic cure for their pet, which is quite understandable to do it. So there are things there which can actually help patients that are beneficial to them. To me, there's another important side to this. We're treating an animal, but we're treating an owner. And they may have beliefs in homeopathy, some of the herbal drugs. And we sell a trust relationship. And certainly me as a veterinarian is no different for the therapists. They come to you because they trust you and you believe in you and that you can really help their patient. And we need to keep that trust relationship. Whether or not we believe entirely in what they're doing, we need to keep that trust going. And one of the ways to destroy that trust is to challenge them on something that they have a belief in. And so to accept part of what they're doing is important, and to use it. I think what's important for the therapist or anybody who deals with patients, I always tell people who go, and I recently had a client who has been to see 3 specialists, 2 surgeons, and a few other people involved on the periphery about their dog. And I said to her, what's important is that you need to have one person in control of the therapy. I always refer to them as like the drug gatekeeper, if I can put it to you that way. It's a big problem in human medicine, by the way. You go and see a cardiologist and he'll prescribe medicine for your heart. You'll go and see, because as we get older, you get back pain. So you go and see a neurologist or an orthopedic surgeon. He prescribes medications for your back. And as you get older, your kidneys go. So you go see a nephrologist. He prescribes drugs, but they all treat their own organ. And what happens is you get drug interactions that happen there in humans because they all prescribe exactly what they think is absolutely perfect for what organs affected by it. And that's why there needs to be a drug keeper who says, okay, you can take these herbals, you're getting this conventional medicine. And I use, there's 2 or 3 journal articles that are review articles that are published in herbal medicine that look at all the reported drug interactions. And I can send you those links so that you can add it into the notes. People can then have a look at those articles, because I don't remember all of it. And then people tell me, I'll go and page through it or look through it and say, okay, are there any reported drug interactions for that? And if it's not listed there, yes, then I'll go and do an internet search on it, see if any of the other big medicine authorities have reported drug interactions, for example, on it, just so that I have an understanding about it. But it's important that there is a single gatekeeper. And as you get more and more people involved, you actually get more drugs prescribed, perhaps for the right or for the wrong reasons. And it's important that somebody controls that, because you can get aberrant events that happen. That recently had to my dad. He's in his 80s, of multiple disease things, and he was taking 17 drugs, which eventually put him in ICU, most probably purely because of a drug interaction. And as I say, herbal remedies are medications. A lot of them alter physiology. You give them in doses that are appreciable. So we need to be aware of it, and somebody somewhere in the management of that patient needs to be the drug gatekeeper, who, if you want to add or take anything out, they're the person who says yes. And it could be the private veterinarian, it could be somebody else involved in the management who keeps track of this and just says, okay, this is what we're giving, all of this is still okay.
Yeah, and I think also one of the problems that you mentioned is that the pet owner often doesn't tell us everything. And I'm not sure why. I mean, I think that for the primary vet, I think that there is the concern that the primary vet is not going to be on board with what they're doing. So they try to hide that information. I do find, as a rehab vet, that the relationship that I have with my clients is a little bit more trusting, and we spend quite a lot of time with them, and they tend to open up a little, and as the consultations go and they start to tell us. But I think that's obviously the person, whoever it is, needs to be someone that the pet owner trusts, so that they're actually honest with everything that they're giving to that pet.
Yeah, and I think it's important to ask specific questions. We seldom forget about that. We'll ask, what are you giving your dog? Or what are you giving your cat, for example? And often they'll list the conventional things, non-steroidal anti-inflammatories, for example, or some gabapentin, and they will list that. And then you actually need to ask, and I always ask people, what supplements are you giving? And to find out if they are, because some of the supplements we give may come in the food, for example, and to ask questions, do you add anything else to their food every evening? And I once had a whole discussion with the owner where I asked these type of questions: do you give any herbal remedies? And I specifically ask, are you using homeopathy? To ask specific questions. Anyway, get towards the end of it, and then I asked the people, like, what's their routine in the evening with the animal? And suddenly I discovered they gave cannabis, but never got mentioned in any of the previous discussions that was there, And I think you're right. People feel as though they're going to be judged. And cannabis is one of those things that sits on the fringe of, is it legal? Isn't it legal? What can you do with it? It has a reputation of being contraband and so on. So yes, they're not that keen to talk about it always. And as I said, it is about asking those questions. We know in surveys conducted in human anesthetics, people don't declare herbal medicines or remedies very often on the paperwork that they fill in when they undergo an anesthetic. And as I say, there's a number of important drug interactions which have been described. So I think people need to look at it carefully, but it's also about asking those questions. And sometimes it's not by asking a direct question. You actually discover it through an indirect question when you ask, what's the routine in the day? What do you do through the whole day? And I often find this out when you realize you've got an obese dog that you're trying to lose weight. And it's usually not the food they're feeding, it's everything else it eats during the day. So you got to limit that down. You actually find out, okay, they give this in a snack, they give this, and it's to work those things out.
Yeah, I think that's great advice. Just asking questions and running through things with them. I think the routine is a good one, because then often things that they're not telling us maybe just pop up. And often you'll also have a child or a partner will say, oh, and we give this, and then the one pet owner was trying to hide that or didn't want to mention it. Kenneth, Do you think that we could run through the most common herbs that vet rehab therapists would be exposed to in supplements or what their clients would be giving, and just talk about potential interactions and any concerns that they might have, just so that they have some knowledge whether they should be referring them back to the referring vet or not?
Yes. Look, I think arnica is the most common. Often it either comes, for example, in a gel that you can massage in, for example. So there are topical remedies, if you can put it that way, as well as systemic remedies, things like Traumeal, for example, which has a whole lot of other additives into it. So there's a number of products available on the market where arnica is incorporated into them. It's not only the primary ingredient, for example. And that does interact with non-steroidal anti-inflammatory. So it can increase a bleeding risk, for example, and it may increase your risk for gastric ulcers. So that to me is something, if people are using, you need to definitely be aware of it. But then you look at a drug like St. John's wort, for example, and that's an inhibitor of metabolism. So it's a cytochrome inhibitor, and it can have a broad range of effects across multiple drugs. It's one of the drugs that's led to death in humans as well because of its interactions in metabolism that is there. So that's something else I always want to know about. And by the way, on a sidetrack slightly, some of the herbal remedies you use come from plants, for example, listed under CITES agreements. So in actual fact, is it then ethical to use those products in our patients that is there? If I look at it, there's a lot of CBD usage, and it's increasing, and we do see toxicity from it, and that will increase as the number of people use it. It itself interacts with some of the analgesics we give, especially, for example, opioids. It can aggravate opioid sedation. It can also delay metabolism of several of the drugs that we use, and it inhibits a number of cytochromes if you have a look at it. So it can alter medications, a number of medications that we give. One of the things, if you look for it, which is not relevant to us, but certainly interactions with contraception, if you look at the human lists, are actually very high with drugs that affect metabolism because they alter humans' contraceptions and how effective they are. So, but that for us in animals is not a major risk that comes forward. Then there's a lot of things that you need to take in really high doses, for example, to have effects. And those don't worry me too much, but they can always interact. And those are things, for example, that come out of the onion families that are used there, things like garlic. Now we're sort of onto garlics and onions. There's things like that. There's also mild interactions, for example, with curcumin, curry powders, basically, at the end of the day. Those aren't that important for us, if I can put it to you that way, that we get. So the ones that, if I look at osteoarthritis patients, I worry about. I think I've listed most of those that I try to get specific answers, but I just go and have a look, as I say, through that package insert that is there.
And devil's claw?
Devil's claw can interact, by the way, with a number of drugs. That is there. There's also some controversy whether we should actually be harvesting devil's claws themselves because they are endangered plants where they come from. So those can be, but its interactions that we do see are similar to St. John's wort. So it's largely influences over metabolism that we do see, where it can exert its exaggeration, and that. Part of that is education as well, because the problem is we don't know how much or how little or how to adjust doses because we're using different medications. And at that point, it's important to educate the client and say, look, these things have been found. It could alter, for example, the opioid that we're giving to your dog. So if you find your dog's becoming too sedated, skip a dose of the opioid and we may need to reduce the dose. But it's about communication that is there. And I think the most important thing for therapists and the people who are not directly prescribing the drugs is to ask questions about side effects. So go and ask the people, how's your dog doing? How's it peeing? Is it peeing normally? Is it drinking more than normal? Is it peeing more than normal? Are the feces all normal? Can it defecate normally? If it's dark brown and tarry, for example, we know we're getting GIT side effects. And looking at mucous membranes, have they changed color? Are they looking yellow? Changes in appetite, for example. Those are all the questions I ask my clients. And if we're keeping all of that normal, that's usually a good sign, because the time we're going to see the side effects most often is right at the beginning of therapy. In the first week is our best time for seeing those, for example. And that's when we need to ask those questions. If a patient's been on a whole lot of medication for years, the chances of something or a drug interaction being important becomes less and less. In other words, there's other things that are going on that have caused those changes. So it's important right at the beginning when we're making changes in therapy to be aware of these things. When we've had stable doses and nothing has changed for several months, that's fine. We should be okay. But if we've got an enzyme inducer, for example, that is there, then it's going to cause us to want to give more of a drug over time because we increase its metabolism. Phenobarb is the traditional drug that classically does it to us. It's an enzyme inducer. So it's important for people to think more about, to me, are we seeing side effects, and then to try and work it out. And if everybody's vigilant to looking for side effects, we can pick up the problem, stop everything. That's what I always tell the clients, stop everything. Doesn't matter whether it's conventional or non-conventional, stop all of them, and either we'll start again, examine the patient, seek veterinary advice. And I think that's an important way to reduce or prevent complications from happening.
Yeah, I think that's really, really good advice. You know, the vet rehab therapists are often seeing these patients twice a week, every week, whereas the vet will often see them and then, you know, have a checkup a few weeks later. So we're in the ideal position to be able to be the eyes and ears for that referring vet. And, you know, we're more likely to pick something up, which might be picked up maybe a few weeks later if we're not asking all those questions. So guys, if you have any patients that are suddenly put onto new medications or something's changed in their treatment, you need to be asking your clients these questions so that if there is any potential side effects or interactions that you pick them up. And, you know, especially in our animal patients where we, you know, as a human, we'd be able to say, I feel nauseous, I feel this. And so those questions are so important because through the pet owner, we might be able to pick up something quite subtle.
Yeah, and ask about behavior or changes in behavior. Is the dog or the cat sleeping more than normal, for example? Is it more active or less active? And the other thing, which I think physiotherapists are better doing than us, is also keeping track of pain. Is there a sudden change in pain score? Because that should trigger some reevaluations, especially patients who have been painful. And I get to see a couple of these patients every year where their pains just suddenly got a lot worse. People know it's got hip dysplasia and it's cruciate ligaments ruptured many years ago, and forget to go back to the basics. And suddenly it's a large breed dog, it's old, it's got an osteosarcoma, and that's why its pains actually changed. So when things go wrong or things change out of kilter, that's one of those things where you need to go back and seek veterinary advice. And the people who have more contact with the patients is the people doing things on an everyday basis. I always say that the nurses are better than us at doing that because they deal with those patients every hour. I see the patient in the morning, or lunchtime, in the evening, or whatever the case may be. It's 3 times a day for 10 minutes. They see the patient for 24 hours a day. And it's the same thing with the rehab physiotherapists who are seeing a patient 2-3 times a week. They may see me once a month or once every 3 months, for example. And that's why you need the other people to pick up these changes. And that, to me, is the most important thing. When the changes happen, we make adjustments and find out what's going on. Why did it change? And sometimes it can be because they've changed medication. And I'll just use CBD because there's so many varieties available on the market and people manufacture it themselves. I've had dogs who have suddenly become sedated. And the reason they've become sedated is they changed their source of product. Is the only way I can put it. They're now getting it for somebody. And because there's no control over how much actually goes into it, they're still giving 3 drops or 4 drops or whatever the case may be, but the source has changed. And suddenly the dog becomes excessively sedated. And it has a very simple solution. Well, actually, let's try and figure out what you were giving and what you're giving now and adjust the dose. But it's just being aware of those changes.
Yeah, and I think you're right. I think vet rehab therapists are very in tune with pain and changes. And it is something that every time we see them, we have a look and see, have they got better or have they got worse? Kenneth, thank you so much. It's been such an interesting conversation, and I always love chatting to you because you're like a veterinary Google. I feel like,
Right.
or like maybe like a PubMed. Like it amazes me at your recall of research articles. Often when somebody asks, like, is there research in this? And I'll actually just say to them, you should ask Kenneth Joubert. He'll probably know because, you are so well read and researched, and it's like you can recall every single research article you've ever read. It amazes me.
Well, no, yeah, I read a lot, and I read a lot all the time. So, yeah, I always have reading stuff with me. So when I'm bored in the middle of anesthetics, I have something to look at, and I often spend time. But I think knowledge is just gained over time. I've just been around too long, and every time I've had a problem or an issue or found something or thought, what's going on here, I go and research it. And by doing that, by the way, it gives you memory recall blocks because you can associate it with patients and things that happened, and then you think, okay, this is where, and it fits into a memory block for me. So that's what makes it easier. And that's often how we learn things, because we have things to remember it by.
Well, we're very honored to have you on the podcast again to share all that knowledge. And no doubt we'll have you on again. You've lectured for us, and the community is very grateful for all the knowledge that you share with us. So thank you so much.
No, it's an absolute pleasure.
And for those of you that are going to be attending Kenneth's webinar, you'll be listening to this recording afterwards, but he's actually lecturing for us tonight, aren't you? The small animal veterinary community, you've got, you probably would have listened to it, and I'm sure it's going to be brilliant. Kenneth, thank you so much for your time. Wonderful to chat to you, and good luck for your webinar tonight.
No, thanks very much. It's a pleasure.
Vet Rehabbers, thanks for listening to my podcast. Don't forget to click the subscribe button, and it would be great if you could leave me a review. I want to know, what are you doing on the 15th to the 17th of November? It is our Vet Rehab Summit, which is our online virtual conference for veterinary rehab professionals. Find out more information at onlinepethealth.com.